When most people hear the word virus, they think of something distant, something that happens elsewhere to someone else. But the Nipah virus is a reminder that some threats never really leave, they wait. In recent weeks, health authorities have once again intensified surveillance following new reports of Nipah virus infections in India. While the number of confirmed cases remains limited, the response has been swift. Because history has taught public health officials one thing clearly: Nipah does not forgive delays. Nipah virus is a zoonotic disease, meaning it spreads from animals to humans. Its natural reservoir is the fruit bat, commonly known as the flying fox. These bats can carry the virus without appearing ill, allowing it to quietly circulate in nature. Humans may become infected through contact with contaminated food, infected animals, or most concerning, through person to person transmission in closed settings, including hospitals. That last point is what makes Nipah particularly dangerous. Unlike many viral infections, Nipah has a high fatality rate, often reported between 40 and 70% in past outbreaks. In severe cases, patients can develop acute respiratory illness or encephalitis, an inflammation of the brain that can progress rapidly, sometimes within days. The current situation has prompted hospitals to activate strict infection control protocols. Healthcare workers who come into close contact with suspected cases are being monitored, isolated when necessary, and tested. Contact tracing teams are working to identify anyone who may have been exposed during the virus's incubation period, which can last up to 3 weeks. So far, officials emphasize that there is no evidence of widespread community transmission. But with Nipah virus, caution is not optional, it is essential. One of the greatest challenges in controlling Nipah outbreaks is early detection. Initial symptoms often resemble common illnesses: fever, headache, fatigue, muscle pain. In the early stages, it can look like influenza or a routine viral infection. By the time neurological symptoms appear, the disease may already be severe. At present, there is no approved vaccine and no specific antiviral treatment for Nipah virus. Medical care is largely supportive, managing symptoms, maintaining oxygen levels, controlling complications, and preventing secondary infections. This makes prevention and containment the most powerful tools available. Public health advisories continue to stress practical preventive measures. In areas under surveillance, people are advised to avoid consuming fruits that may have been contaminated by bats, especially partially eaten or fallen fruit. In some regions, raw date palm sap, known to attract fruit bats, has been identified as a potential source of spillover and is discouraged during outbreak periods. Hospitals, meanwhile, are reinforcing the use of personal protective equipment, isolation wards, and strict hygiene practices. These measures may seem familiar now, but they remain critical, especially when dealing with a virus capable of spreading in clinical settings. Beyond national borders, neighboring regions are also on alert. International health agencies are monitoring the situation closely, emphasizing coordination under the One Health approach, which recognizes that human health, animal health, and environmental health are deeply connected. Nipah virus outbreaks are rare, but they are not random. They tend to emerge where human activity intersects closely with wildlife habitats. As urban expansion, deforestation, and climate pressures increase, experts warn that spillover events may become more frequent, not less. For now, health authorities maintain that the risk to the general public remains low. But they also stress that transparency, vigilance, and rapid response are essential to keeping it that way. The story of Nipah virus is not just about a pathogen, it is about preparedness, about how quickly systems respond, and about how seriously early warnings are taken. Because with Nipah, the difference between a contained outbreak and a national emergency is measured not in months but in days.